To explain a little bit more about how we actually work, let's use an example. If you have some shoulder pain and we test all the muscles that govern the shoulder and we find that a lot of them you really can't connect with, what we have to do is find the source of the information that's causing that. And so we can use very simplistic methods to locate the source of that, such as rubbing and compression. Because what these act as are signal blockers, essentially. Just like if I accidentally bang my elbow, I'm going to rub it subconsciously immediately because I know it's going to feel better. And the reason why we do that is because we're actually blocking the ability of the nerve endings to send information to the brain, and so essentially we're blocking the pain. We can use that as a way to temporarily find sources of heightened sensitivity in areas of the body. So if we test the muscles that govern the shoulder and they're all pretty difficult, hard to connect to, and they feel quite weak, and then we find a place that when we rub, let's say on the ligament on top, everything temporarily gets stronger, then although it's not a treatment, it's diagnostic. It tells us that there must be some heightened sensitivity in that area that's causing those muscles to switch off. What we then have to do in order to change that sensitivity is essentially give the brain some updated information. And really, it's quite simplistic. We find the place that your brain is most threatened by. In this case, let's say it's the ligament in the shoulder. We then have to find your best compensation for that. And so that might be another ligament slightly adjacent to that area that compensates to create balance in the body. And so if we can stimulate both of those successively and use a reflex, what's been found is that that has an ability to reset the threshold within that ligament. So instead of now a small amount of stretch on that ligament causing a problem, it would have to take a normal amount or a much larger amount to create a threat and therefore increase the likelihood of pain. So we're essentially looking for places of high sensitivity and places that compensate. Show that information to the brain and essentially act like a factory reset so that you can simply now do a normal thing without change.